in this study, which is the biggest in its in this area, we identify 4 specific subclusters. One is the hyperandrogenomic subcluster or phenotype, which is characterized by elevated levels of androgens. And this group is the group with the highest risk of miscarriage, and also an higher incidence of abnormal lipids in the circulation, and also type 2 diabetes. The second one is the obesity subtype. They, of course, have higher BMI. They're also more insulin resistant and the highest risk of type 2 diabetes. And they also have difficulties in becoming pregnant and a lower live birth rate. And then we have a high SHBG, or the SHBG, sex hormone binding globulin phenotype, which is the least affected phenotype, I would say. They have less metabolic problem, but also less problem with reproduction. And then we have a high LH or LH PCOS phenotype. They have high luteinizing hormone and also high anti-Müllerian hormone. And if they have high anti-Müllerian hormone, they have accumulation of many small follicles. So when they are hormonally stimulated, for example, when they do in vitro fertilization or just ovulation induction, they respond very well, but they can also become overstimulated, which is a risk. Yeah, if you know all this and you know their risks, it of course, if you then can get the phenotype of the patient you have in front of you, if you are a doctor, you can also guide whether this person does belong to the hyperandrogenic phenotype. Yeah, then you know that you should target your treatment really to reduce and lower their androgen level. And usually they become more regular ovulations if you do so. If you have the obese phenotype, that is the main driver. You can still have high androgens and LH, but then you really need to target the obesity. And yeah, so in this case, you can really more target your treatment and see which is the main features you should try to treat. Mm. This in the study, it is also there is created a web page that the clinical doctor can use. So what they need to do is, of course, to analyze all these measures that are required to get these specific phenotypes. As soon as they have these measures, which are no strange methods, although it's not always you measure everything in your patients, it's usually due to cost. But if you do that, then you can immediately, when you have the patient in front of you, more or less, get the results in which phenotype they belong to. And by that, you can also guide them and give instructions if it is more diet, exercise, or targeting their insulin resistance, or whether it's more the endocrine hyperandrogenemia you need to target. It sounds, I would say maybe it sounds a bit easy because it's always, when you meet the patients, is of course the symptom that they seek help for that must be taken care of. But it's also with this, you can maybe understand why they have their symptoms. Yeah, I want to highlight the importance of actually diagnosing these women. Many of these women are still undiagnosed, and therefore they do not get any treatment or treatment that are for these women. So I think first of all, it's important to diagnose, but when you diagnose a woman, it's also very important to give detailed information. There is quite a lot of detailed information based on the most recent evidence-based guidelines that is for both diagnosing and management of women with PCOS. It's highlighting how important it is to take care of all symptoms, not just ovulation or menstrual irregularities and obesity, as I mentioned with this subtypes, but it's also very important that you ask regarding the mental health issues and um, and see the whole patient. And this is through a life perspective, I would say. If you have, I didn't mention that it is that if you have disturbing hair growth, it's also very important that the woman get help for it. If the oral contraceptives, for example, aim to reduce androgen, but that is not always enough. And then you really need to send them so they can get help for hair removal. Many women feel this is a very how do you say disturbing symptom.